actually get trained on how to do your data entry, well, that doesn't quite work anymore, because as many of you have probably heard or know, the system recently changed to a multi-database system where we have people in all different databases. So to train you all on just one database when some of you may be in a different one is kind of a waste of your time. So what we're going through today is just the basics of what is electronic data entry, why do we do it, some of the confidentiality and security concerns. And one of the first steps to get in any of the 3 databases that our system uses is to make sure that you go through a training like this so you know how to protect the client data that's in there, and then sign the user agreement that got passed around. Just because we've got people shifting all over, even if you've signed this agreement before, great, you know what it reads, except for now instead of client track it says client database. So it's generic, so it will work for any of them. And basically everything on there is what I'm going through in the PowerPoint slide today. So why an electronic data system? What this does is we hope on your side gives you an enhanced ability to track what's going on with your client, the services they're getting and the needs they have. There's a lot of stuff that you can do with electronic and summarizing that you can't do in a paper file very easily. It also allows us to report to the funders who pay for these services, so that's how we get the money back in to pay for the system. It does allow us to track if the service is meeting the needs of our clients. For example, if you're indicating in a lot of your data entry that your clients have dental service needs, and we know there's only one provider across the whole city, that may give us some leverage to advocate for more dental services within the city. That's just an example. And it allows us to do advocacy and fundraising to expand services. And one example I like to give is shortly after we implemented client topics, so where case managers indicate what they talked about with their clients. We went to the City of Chicago Housing Department and we told them that Ryan White medical case managers are talking about housing because you've reduced housing advocacy and here's the numbers to prove it. And so we were actually able to advocate to try to get funding restored to housing advocacy. So in the cooperative, how we do electronic data is we have lots and lots of databases, and I just made this dramatic because there's so many of them, right? So Client Track is the one used at the AIDS Foundation of Chicago, and then Provide is from the Illinois Department of Public Health, VCM is from the Department of Rehabilitative Services, and your agency may have its own database on top of that, and if you get prevention funding, you might have a CDC database, and if you get funding from some other source, you may have yet another. And we realize this is the reality for case managers. So you may be entering data in multiple sources. We try to make that as easy as possible. What you'll be entering as a part of your case management is listed up here. Some of this is up and coming, so if you talk to your colleagues who went through this training before, they'll be like, what? We have to do what? Because some of this is new. So of course we get the basic demographics because that's what the funders want to know who they paid for services for. So that would be things like the race, the ethnicity of your clients, their age, their gender. Anything that you record on an intake or reassessments. For the DERS client, your DERS intake and reassessment, the DON scores, those are not entered right now. When we move into VCM, it's likely that you will have to enter that into VCM. So do keep that in mind. Right now, only the Ryan White portion of your reassessments are going in. Service plans are something that right now, if you're Part B funded, are live. You must enter those. If you're Part A or DERS funded, that's a coming feature. So you will be entering those. Are there any housing case managers here? Okay, so I will. Housing also, they're exploring whether or not those are going to go in. There will be some tracking of service plans. Service encounters you put in. So anytime you've seen your client face-to-face, talked to them over the phone, done collateral work on behalf, sent them a letter trying to contact them, left them a voicemail, all of that gets entered so that we can track these services you're providing to the client. Your case notes that go along with that encounter. And C file is not a case note. This has to be your actual case note. And I say that because there are some notes in the system that say C file. Well, that is not a case note. I can't read that and tell you what you did with the client.
Thank you, Carrie.
Also, you want to indicate the topics you discussed in that section. And so you may say, well, isn't that what a case note is about? So a case note is a narrative form, and if I wanted to say, well, how many clients talked about housing with their case managers, I'd have to read every client's case note from every time they talk to your clients. I'm never going to get an answer of how many case managers and clients talk about housing. If you check a box that says I talked about housing, all I do is push a button and say how many said that they talked about housing. Right there I can tell you. So that's why you have to do both the topics and the case notes. Any referrals you make. And so that, that's a big thing. That's case management. They want to know, well, who are they referring them to? Are they really hooking them up with medical services? Are they sending them to dentists, to eye care professionals? That's where we're able to show this, that you're making those referrals, following up with the client to see how those referrals went. The medical eligibility forms that you get back from the doctors, or at least try to get back from the doctors, those also go in there so that we're able to track the medical history of the clients. And finally, this is something, again, that's new. Part B requires that you upload your eligibility documentation. So your proof of residency, your proof of income, your driver's license, things like that actually have to be scanned into the system. And so because one funder requires that, we're going to start implementing that across all of our systems.
In Client Track, is there a place where we're supposed to be checking off boxes for referrals the same way we do topics, or do we just cover that in a note?
There is a whole section for referrals in Client Track.
Great.
Yeah. And so
I'll look for that.
Yeah. It's a purple box along the side.
Okay.
Yeah. And so every system has that. So any of the systems that you get into, you must be trained before you get into them. This is part 1 of the training. Part 2 will be actually in the system that you'll be working in. And so if you're going to be working in Client Track, we'll schedule a training and have you all come in, and you'll actually get to find out where referrals are or where the case notes are. If you're in Provide, we'll work with you to contact the Illinois Department of Public Health, who will get you trained on entering and Provide. And when VCM comes down, we'll do the same thing with VCM. So you will be given a password that's unique to you, and you don't want to share that password with anybody else. So don't give it to anybody while you're gone on vacation. If you have a coworker covering for you, they should have their own login and password to the database that you're using. If your agency needs extra people trained in order to provide that coverage, let us know here at AFC and we will get them covered. Also, just a note for supervisors, that doesn't get passed down to your predecessor, your people coming after you. So if you leave the agency, they can't give you your password to the next person. So once you do get your password, because that is tied to you, you are responsible for taking care of that password. And if we find out that you don't, we could take your password away, which means you can't get in and enter data, which means we think you did nothing, which, why did we pay you, right? So this is a bad thing. So how do you keep your password safe? Always try to store your password in a different location from where you log into your computer. So for example, Provide is you have to be on a specific computer to use it. Don't put the password next to that computer. Client Track is a web-based system. Anytime you have a computer that can type in the web address, you can get to Client Track. So don't put the web address next to the password, right? Things like that. Try to keep things separate. Another way is to make sure that your password is hard to guess. And one way to do that is you have to have capitals and lower cases and numbers and funky symbols. And, don't make it too obvious. So try to shake things up a little bit. So once you've got in, and now you're putting client information in, I'm sure you've seen now on day 5, you've seen the intakes and reassessments. You know the vast amount of information that our clients are entrusting us with, right? I mean, they've given you everything but their underwear size. So we really have to be careful with that. One of the things we do is we notify them that we're going to be sending their data somewhere. If they haven't been notified that we're going to be sending your data over to AFC and putting it in this big database, it should not be sent to us. Fortunately, if you've done all of your case management forms, they've already signed this consent. That's one of the consents that you have there at the beginning. they've signed it, they've been notified in writing you've met this requirement. If you do not have that form signed, they do not get entered into client track. I want to emphasize that. You know, if they refuse, which is one of these next slides, you'll want to have them contact the folks here at AFC because they may not be able to access some services because of that.
I have a question. What if you have a client that's been referred to you and then you've like talked to them, you've set up an initial assessment, and then they like move or something, like all these things happen where you never actually meet with them to do the paperwork, but you've like in client track like said like called client to set up appointment, like.
So you never opened the case actually?
No. But they're in client track under your name because they've been referred to you through AFC.
Well, you have to close the case as if we give you the option, they close the case.
Right, but so like I had a client that was
the
endorsed.
information that's in there already, they provided verbal consent to have it entered and sent to you.
Okay.
And so, but you wouldn't like, so for example, if you fill out an intake and on the very last page they say, you know what, just kidding, I really don't want case management, even though I spent an hour with you trying to fill this thing out, right?
Right.
At that point, you would not enter that intake into client track because they didn't sign the consent to have it entered.
Okay.
Yeah, but when we do the screening here and if the contact never happened, then we have that option to close the case because the initial contact never happened. And
Well, no, like I had a client that the initial contact happened. Like we talked like 3 times. We had set up a initial assessment, and then he called and had moved to like Harvey and was going to get a new case manager. So all of that was documented. Like talked to client, client's moving, called AFC. So that's still okay to document because then.
Yeah. Oh,
okay,
yeah.
so it's just more like personal information.
Oh yeah.
Okay.
Especially if the client give you sign the consent and did the whole as initial.
No, he did.
Didn't sign the consent
But
yet.
still, yeah, and then you close the case.
Okay.
Yeah.
Oh, actually, down here on the bottom. And if the client decides that at some point they don't want to be able to send this to AFC anymore, they do have the right to revoke that in writing. What happens is everything that's already in the database was covered by their prior consent, so we just stop the ability to enter any new information. So that's kind of what you were talking about, like what's in the database already. They provided verbal consent for us to enter it in, but we can't enter any new information in until we get the written one that you all are gathering at the intake. And so in this way, if the client decides that now they're getting a little scared about the amount of information that's going into the database, they no longer want it, have them send a letter in writing to the AIDS Foundation, and then we'll stop the use of that file. The one thing is you'll want to have them contact the care team here at the AIDS Foundation to walk them through the potential loss of services. Some of our funders won't pay for a service if they don't know who they provided it to. So it may be that they will lose some of those services. So maintain client confidentiality. The main thing I think about here is treat it a lot like a paper file. You wouldn't get up from your desk and leave a paper file strewn all across the desk and get up and walk out and everybody walks through your desk and sees the paper file. Think of your electronic file in the same way. So don't get up from your computer and leave your database open. Because then if anybody sat down at your computer, they'd have access to all of your client files, right? So think about things like that. Another common one is think about where your monitor is located. If you're in a group office and there's lots of people running in and out of your office and your monitor is facing towards the door, think about who walks by that door. An example I give is I used to work in one of the cubicles that the row was shared with the communications department here at the AIDS Foundation. They got lots of visitors. If the communications department had a visitor, I had to be conscious of who was going to walk by my computer and see the client information and perhaps choose to work on something else at that moment, things like that in order to protect client confidentiality. And do follow all the stuff in your manual that I'm sure you've gone over, confidentiality, and we can take away your access again if we find that you're putting client data at risk. A note on where you connect from. Client Track, I mentioned before, that's a web-based system and it's not tied to a specific computer. So theoretically, you could go down to the local Starbucks and connect to Client Track. Anybody in here think that's a good idea? All right, you know, think about if that was your information. You saw what you're giving out on that form, right? Think about if that was your information and somebody was browsing that at the local Starbucks, you know. Not a very good thing. Also think about if you're the kind that likes to beg to work at home, think about who's at home with you. If it's you and cats, cats probably aren't going to tell anybody. If it's you and roommates or family members, you know, you probably shouldn't be accessing it from home when they're home. So, data sharing is just like with the paper file. If you don't have a consent, you don't share the information. So within the cooperative, we have a consent. You basically confirm to a fellow case manager, yes, I'm working with the client, they're mine, let's figure out which one of us the client needs to work with, right? You can verify that, you can say, okay, what's the date of birth so we can make sure we have the right John Smith, because there's lots of John Smiths. But beyond that basic de-identification, even within the cooperative, you're not sharing. So you can't say, oh yeah, and let me tell you what John Smith told me the other day. Oh really? He didn't tell me that, he told me this. You know, none of that, just, yes, I served John Smith. Okay, so at any point, a client can request a copy of their electronic file. If you get that kind of request, don't worry, you don't have to figure out how to do that. Send them my way. I will figure out some way of getting them a copy of every single piece of information you've entered into their file. I will get that to you and you can get that to them. So if you ever get those requests, have them put it in writing, send it over to me. And again, we can freeze their file so that no new information gets entered if they have concerns about that. For the data quality, you are responsible for the quality of your data, as is your supervisor. So we want to make sure that you're entering accurately. So if you actually saw somebody, put that you saw them. If you did not see somebody, don't say that you saw somebody, right? You know, make sure that your electronic file reflects reality. There are several ways you can go through and do that. One is that we have monthly service reports that we hand out to contract administrators. You can get those same kind of reports right in the databases. So I know both Provide and Client Track have ways for you to look at the services you've entered. And you can request additional reports if you don't find one you need in there. And we can audit that data for up to 5 years, so that's one thing. Also note that you're required to have everything entered within 5 business days of having done it. So if you did an intake on Monday, by Friday you should have your intake in the system. So just 5 days, right? And that's partly so that we can report back to our funders, because if you know they want to know as soon as they provided the service what service they provided, and we tell them, well, they're still entering it, and they're like, well, why are they still entering it a month later? Like, because we didn't tell them that they had 5 days. So 5 days. That'll make it easier for us to report to our funders. It also keeps things up to date so that we know what's going on with the clients. And one of the things that we've seen is that, you know, if we have clients that are supposedly in medical case management, right? Medical's a higher tier, they should be being seen, and they haven't been seen by their case manager in 6 months. Well, is it that the case manager is not entering data, or is it that they really shouldn't be in medical case management? Right? If you're not entering your data, we have no way of knowing that. We're going to close your client out and send more your way. So, you know, it's for your benefit to put it in. Okay, so what happens next? Well, first of all, you got to find out what funding source is paying for your position, because that's going to determine what database you're using. If you have problems with that, I'm sure Ileana can help you figure out how you would figure that out. And so once you're able to figure out your database, then you want to sign up for a training on that particular database. And once you're signed into that training, we'll give you your login and password. That's why it kind of takes a while. We're trying to figure out how to get these processes convinced so that it's not like 6 months after you started that you finally get in and are able to enter data. So who does use what? So if you are a housing, PACB, corrections, Ryan White Part A funded case manager, or for right now, a DERS funded case manager, you're going to use Client Track. So you'll want to sign up for a Client Track training. If you're funded by Ryan White Part B, you're going to be using Provide. And if you're in DERS, you get real fun because you're starting in Client Track and eventually moving into VCM. If you're multiple of these, sign up for both trainings, unfortunately. None of our systems were, both VCM and Provide refused to allow us to send them the data, so you have to actually enter it directly into each of those databases. So, unfortunately. So is everybody, you've got that should be in your slides if you need that cheat sheet once you figure out where you're from.
How do you transfer clients within an agency from one percentage to another?
But actually right now, okay, so within the agency is different. So between agencies, if you're transferring a client, at this point you do need to call back to Angela and Maria because they need to make sure that the client is in the right database and not getting in both and all of that. Within the agency, I think if you're in the same database, in Client Track, I know you can probably transfer them. If you're transferring between like DERS and Ryan White, you'll have to call AFC again. So in general, probably call here and we can help walk you through that if you can do it yourself.